In this lesson, we'll take a look at the white heart model. We'll focus on the external features or the exterior features, and then we'll take a look at the internal features. If you had a chance to take a look at the brown heart or the brown heart video that I had done, you'll see much of this is the same with some minor differences. So remember that the heart is a triangle. The base of the heart is up over here, and this is going to contain all the great vessels. The tip of the heart, would be the tip of the triangle right there, that would be the apex. Now, this is the left side of the heart right here. This is the right side of the heart. In here is one of the upper chambers. Inside here we cut would be the left atrium. Over here would be the right atrium, right? If we cut inside here, we would see the chamber. Each chamber is covered by a pouch. So this pouch right here is the right auricle. This pouch over here, left auricle. Right down here is the left ventricle. And if we cut in here, we would see the right ventricle. Now, separating the atria above from the ventricles below is a sulcus. Remember, a sulcus is just a word for a groove. So this groove right here is the coronary sulcus. It's separating the atria above from the ventricles below. And we'll see it again on the back when we turn this around. And then there's one other groove right here. It's really hard to see on this model only because the veins, arteries, and nerves are in there. So we don't really see the groove, but there's a groove in here that these vessels are sitting in. This is known as the anterior interventricular sulcus. So that's pretty much everything from the front. Let's turn it around. So again, how do we know we're looking at a posterior view? I went over this in the brown heart model video. Look for this vein right here. If you see this vein, I don't have it labeled here, but this is the coronary sinus. If you see that, you're looking at a posterior view. So just to give you some bearings, this would be the right atrium up over here. Right ventricle would be in here. Left atrium inside here. Left ventricle inside here. We see the coronary sulcus again. That's this groove here. This kind of continues around from the front. This whole groove, just it's filled with blood vessels all in here, right? We can see the coronary sinus sitting in the coronary sulcus right here. And then another groove going down right here. This is the posterior interventricular sulcus, right? This artery and this vein are sitting in it, so it's a little bit tough to see. If we were able to strip those vessels out, right, we would definitely be able to see the groove. So you have to use your imagination a little bit. Okay, so those are the main features of the external features of the white heart. So let's take a look at the internal features now, the interior view. So we can see here, there's a little hinge, so you're able to kind of flip this open. And so this is the front part of the right atrium. This is the front part of the right ventricle. And you can see over here, left atrium, right, I'm sorry, the left ventricle down over here. There's these little hinges, kind of like doors, we could kind of open things up. So here we see the right atrium on the inside, right ventricle. Left atrium, left ventricle. On this view, we can definitely see a nice interventricular septum here, the wall that separates the two ventricles, right, made of cardiac muscle. But I didn't label the interatrial septum. What you basically have to do on this model, we don't really see it. You'd have to actually stick your finger deep inside here and deep inside here, and your fingers would actually come together and you'd feel the wall in the middle. So we don't see it, but the interatrial septum is more on the inside and posterior on this model. So you actually have to stick your finger in there to feel it. So I didn't label it, but it's in there. Okay, so let's take a look at the features on the right side of the heart. So here's your right atrium. We can see the superior vena cava bringing blood in right here. Here's the inside of the auricle, which we didn't see on the brown heart model. So I'm showing you a new structure now. These are muscles called the pectinate muscles, and they contract and they squeeze the blood out of the auricle, any blood that may be in there. So we didn't really see that on the brown heart model. Now we jump down. This is the right ventricle. We could see the tricuspid valve right here. We could see the chordae tendineae. right? They help to hold the valve down, and then they connect to the papillary muscles down over here. All of these muscular ridges in here, all of the muscular ridges, we can see them here, right, on the ventricle wall, are the trabeculae carnae. Now, when the right ventricle contracts, it's going to push the blood up, right? The tricuspid valve will close, but now the blood's going to go into the pulmonary trunk. That's this blood vessel right here. The valve, we could see a little bit there, that's opening up to allow the blood to go into the pulmonary trunk, is the pulmonary semilunar valve. And if you want, you could just say pulmonary valve. That would be acceptable. So those are the main features we could see on the right side of the white heart model. And just to finish up this lesson, on the left side, left atrium here. Now, we could see 2 of the 4 blood vessels that are draining blood into the left atrium. These are the pulmonary veins. They're bringing oxygenated blood back to the left atrium. Here's the inside of the left auricle, so we can see the pectinate muscles on this side. The mitral valve right here, chordae tendineae that hold the mitral valve down, and then these chordae tendineae would attach to the papillary muscles. We see them right there. And all of the trabeculae carnae. Right? Again, we did it before, but this is the interventricular septum. And I just, while we have it here, I mentioned it on the previous lesson, this right ventricle wall right here, see how it's much thinner than the left ventricle wall? Right, and that's because that left ventricle has to contract a little bit more forcefully to get the blood into the aorta and then bring the blood to the rest of the body. Okay, so that concludes this lesson on the external and internal view of the white heart model.